It is the third week of class, and this week we're going to discuss an introduction to qualitative research. By the end of the week, I hope that you will be able to describe the components of a qualitative research report. Describe the beliefs generally held by qualitative researchers, and identify 4 ways qualitative findings can be used in evidence based practice. Let's begin by discussing the definition of qualitative research and a little bit about why when you search for a definition, you will most likely find many. Many people do not want to provide a definition for qualitative research because it has changed so much in the last 20 years. One definition that is commonly used is by Creswell. And Creswell wrote Qualitative Inquiry and Research Design, and this is a book used by many qualitative researchers, and for many of us, it was one of the first qualitative research books that we read, and probably many of us still have a copy. And just like the definitions, many of those copies may be 20 years old. Qualitative research begins with assumptions and the use of interpretive or theoretical frameworks that inform the study of research problems, addressing the meanings individuals or groups ascribe to a social or human problem. To study this problem, qualitative researchers use an emerging qualitative approach to inquiry, the collection of data in a natural setting sensitive to the people and places under study, and data analysis that is both inductive and deductive and establishes patterns or themes. The final written report or presentation includes the voices of participants, the reflexivity of the researcher, a complex description and interpretation of the problem, and its contribution to the literature or a call for change. What does this all mean? Well, one way to think of it is that qualitative research uses words rather than numbers. It matters to the qualitative researcher what the person says and how they say it in their own voice. Frequently, that results in extensive interviews that are generally recorded so that rather than you trying to take notes about what the person is saying, you are actually capturing that person's own voice and their exact words. This prevents you, or helps to prevent you as a researcher, from kind of inflicting your own biases on what the person is saying. This then helps us to see the world through the eyes of another person. And as nurse researchers, that other person is frequently through the eyes of our patients or our clients. As educators, it may be through the eyes of students. Or as a person that's interested in public or community health and major public health problems like gun violence, it may be through the eyes of the person who has been a victim of gun violence or through the family that survives that violence. Qualitative researchers believe that to understand, you must understand in the context in which it takes place. If I study nurses' response to disaster, it is better to understand them in the context of a disaster. One of the interesting things that frequently happens is we ask ourselves, can we do those interviews while there is an ongoing disaster? Or must we wait until it's over? And the thing that you need to consider is that my perspective right now in the middle of COVID may be very different than how I see this 6 months from now. Here's one way to think about that. As nursing students, and many of you can remember the days that you were first learning to start an IV or care for a patient with a chest tube. There are many of these procedure like things that you did. Care plans or care maps, or another example. And when you were a student and you wrote that first care plan or care map, I can't tell you how many students have told me they cried over those. That it was so stressful that it actually brought them to tears. And yet, 6 months after you graduate, you do them and you look back and you say, I don't understand why I ever thought this was hard. It's just second nature. The same thing can be true if you were interviewing a nurse caring for COVID patients now, as opposed to 6 months after this pandemic has passed. The perceptions you get may be very different. So the context matters. And that is something that qualitative research captures. Your textbook has this diagram in it, and I think the diagram will be very helpful to you. The example they're using is of HIV, but I would ask you, when you look through this, read what they wrote, read the example and work through it with them. But when you work through these questions, I would say apply the area that you are writing on during this semester and work through these same questions. In fact, you may want to pause this for a minute, pull up the topic you're working on, and see if you could just start with researcher beliefs. Just that one thing, researcher beliefs about your topic, and say, and answer some of these questions. And then see where you would go from there. And then come back and restart it, and we can move on to steps in the research process. One of the first steps is always the literature review. You may find that there are no studies on your exact topic, but you may find people that have studied either the population or a similar disease or a similar action. You may need to even be a little creative. The study design is your plan. The study design, you describe how you are going to do your research. It must match the design. So let me think of another way to say this. Your literature review and your study design and your question need to all match up. And one of the things that you do is you want to make sure that your design is congruent with the philosophical beliefs that qualitative researchers hold. You may not expect to see qualitative researchers use methods common to quantitative researchers, such as random samples or complex statistics. You're not going to see that in qualitative research. Rather, what you are likely going to see is things that are more observational. You're going to see interviews, and I think that you will, over time, understand why this is important for nurses in understanding the perspective of the patients. Next, you need to decide on your sample. The pick of the sample needs to be purposeful. If I want to know about the lived experiences of nurses caring for patients with COVID 19, what would my sample be? I might want to include men and women, um, nurses, certainly, but ideally, what I want is nurses who have cared for COVID patients that have COVID 19. And then you might want to say, well, are there inclusion and exclusion criteria? And I might want to include all nurses who have cared for any patients with COVID 19, or I may want to only include nurses who have worked on designated COVID units. I may want to exclude nurses who had COVID themselves. Now, why would I want to do that? I may want to do it because I might think it may bias their perspective. Now, I personally don't believe that, but it is a possibility. And then you need to think about your settings. And is the setting where you are thinking about this a hospital? Is it in the community? So if we stick with the COVID example, not all people who contract COVID 19 are hospitalized. And we know that. In fact, the majority are not. So if you only include the hospital setting, then you're excluding the majority of, if you're looking at patients, the majority of patients that had COVID 19. If you're looking at nurses, you're excluding a large number of nurses who probably had contact either through a health clinic or a provider's office of some sort, or as a public health nurse, or even a school nurse. The setting then becomes important, and then you have to come up with your data collection methods. One of the things we'll tell you is that there are many ways to do an interview, but one of the suggestions is that you always make sure that you record your interview. And you want to record it once again because you want to make sure you capture the voice of the person you are recording. And I don't mean their actual physical voice as much as I mean you want to record their exact words of what they are saying. If we take notes, and there was a time when we used to take notes rather than always doing recordings, one of the things that happens is you can get your own biases into the notes that you're transcribing. Whereas if you have a recording, then you have the exact words, and you can have those exact words transcribed. Data analysis is a big, long discussion, and for another time. There is a brief section in your book about levels of data analysis, and I'm going to show you a couple of graphics about that. And then, of course, your findings and your conclusions are always important. But let's go just a little bit further and talk about applying qualitative research in practice. There are many levels of complexity, and the greater the level of complexity and discovery, the stronger the potential clinical applications, which means the more detailed the researcher is, the more applicable and the more trustworthy the evidence is. Qualitative research will never be generalizable in the way that a randomized controlled trial is, but it tells us something different. So your table, this of categories of qualitative findings, takes you from the least complex to the most complex, from a category that's restricted to a priori frameworks, Examples of that would be the use of theory relatedness to describe women's relationships without substantiation in the data. Descriptive categories or phenomena are vividly portrayed from new perspectives. So, children's descriptions of pain are a good example. And then it walks you all the way through to dense explanatory descriptions. So, rich, situated understanding of multifaceted and varied human phenomena in unique situations. So, unique cultural conditions and family breakdown and hopelessness that led young people to deliberately expose themselves to HIV would be an example. Again, these go from the least to the most complex, remembering that the greater the level of complexity and discovery, the stronger the potential clinical applications. There's another table from the same author that's the modes of clinical application for qualitative research. And these are really helpful for you because they help you to know how you would apply this in your practice. Often we look at a research article and say, how does this apply to me? For many nurses, qualitative research is easier to apply because it helps us to understand the care we provide better. It gives us insight or empathy to better understanding our patients and offering more sensitive support. It gives us assessment of status or progress, so descriptions of trajectories of illness. It helps us with anticipatory guidance, so sharing qualitative findings with the patients, and sometimes it is helpful to let people know that they are not alone. They are not the only one who has been through what they are going through. It can give them hope. And then we can use it for coaching, so advising patients on steps that they can take to reduce distress or improve adjustment to an illness. And then one way to do this is through the stages of recovery or depression, as an example. And I suspect that if you paused a moment, you could think of instances where each one of these has applied to your practice as a nurse. Qualitative research is not designed to test a hypothesis or to make predictions about causal effects. As we use qualitative methods, these findings become more and more valuable as they help us discover unmet patient needs, entire groups of patients that have been neglected, and new processes for delivery of care to a population. Take a moment and pause the video. Think about your clinical practice and think of one area of unmet patient needs. And when you've thought of one area of unmet patient needs, then consider, is there a project that I could do to help meet those unmet needs within my work environment? Do you know how to go about doing that? If you have any questions, please join me during office hours. You all have the Zoom link. You know how to reach out to me. Again, this was just a very brief overview, and there are more detailed videos to follow about the different types of qualitative research.